It's very much a mixed picture right now at ECMC and other hospitals as they do see the COVID caseload picking up substantially, but in a much different way with patients and treatment.
What we're seeing now is the virus itself seems to be more transmissible, meaning that we're seeing huge spikes in the positive rate across our community. Um, but we have continued to see the trend, thankfully, that the mortality rate is not as high as it was back in the spring. My ICU beds are not now chock full of COVID patients like they were in the spring, but now my medical beds are full. And so, in the spring, in the peak, we had about 46 or so patients. We had 75 a couple days ago. And so that's really straining our regular medical bed resources and our regular medical surgical nurses and staff and doctors.
So, more COVID patients coming in, but also more knowledgeable with COVID experience based medical care. For example, much less use of ventilators or intubation, which could subject patients to dangerous infections on their own, and more effective treatments now like remdesivir, antibodies, rotation of patients called proning, and steroids, much like those used to treat asthma.
We discovered that the patients who have COVID have like kind of runaway inflammation. The thought was, well, the steroids reduce inflammation on a broad level, so they might work, and turns out they do. So that was a revelation that has definitely saved lives in the last 10 months.
Ron Plants, Channel 2 News.